Appetite problems are really common in dementia. Actually, maybe about a third of my patients are having appetite problems right now. And what I really want you to understand is that there are some things that we can do about treating appetite loss, but it is important to know why. So number one, make sure that you know whether the person is chewing and swallowing okay. This is a major issue, particularly as the dementia progresses to the more moderate to severe stages. People can have significant problems with swallowing. Issues like ill-fitting dentures, for example, problems with the gums, problems with the teeth that can cause pain and discomfort are also common causes of loss of appetite. Number two, constipation. Who would have thought, right? But just think about it. If you're stopped up on one end, then the body eventually says, don't put any more in there. So it is important to know if your loved one or the person with dementia is going to the bathroom regularly. Really important. Number three, is the person depressed? Loss of appetite is one of the really common findings in depression. And approximately between 60 to 70% of people with dementia experience depression. Number four, medications. Things like antibiotics, antidepressants like of the selective serotonin reuptake inhibitors, medications like fluoxetine or Prozac, escitalopram or Lexapro, Wellbutrin or bupropion. All of those meds are associated with lack of appetite. And interestingly, medications for dementia. There is a group of medicines called cholinesterase inhibitors, and these are notorious for causing appetite problems. In particular, one called donepezil, and the other name for it is Aricept. If you have addressed all of those issues, then here are some pointers that can help your loved one eat a little better. Number one, maybe consider smaller portions. It can be really overwhelming for someone with dementia to have a full plate of food, particularly because as the disease progresses, they may not even recognize that that is food, or that you're supposed to take this and put it in your mouth and swallow it. You know, this can happen a lot in the more moderate to severe stages of the disease, and this is why in memory units, many of the patients with the severe dementia are at a feeder table where there's people there helping them to eat. Another thing are finger foods. Many people with dementia have already lost their ability to know what the utensils are for or even how to use them. So you can simplify things by giving them finger foods, things that they can easily pick up with their fingers and take them to their mouth on their own. It's actually something that the patients enjoy, makes eating rather fun, and it can be really effective. And of course, think about their preferences. Make sure that you're giving your loved one their favorite foods. It'll make it a lot easier for them, and it'll make it a lot easier for you as well. Also consider softer foods. In particular, if there's problems with chewing or swallowing, things like mashed potatoes, steamed veggies, maybe avoiding meats, hot dogs, things like that can make a big difference. If your loved one with dementia is doing what we call pocketing the food, it may be time to have what is called a swallowing study done. The way that this typically presents is like the person will chew but not swallow. And many times they begin to pocket their food on the sides of the cheeks. And this is important because that can lead to aspiration pneumonia. That can have like really serious complications. So if your loved one is pocketing food, just remember it may be a good idea to engage a speech therapist or someone who can help to order a swallowing study. Socialization. I heard somewhere that God doesn't even like to go to dinner alone. And think about it. Food is meant to be shared. I think that when my patients with dementia are eating in an isolated place like their room, for example, they eat less. Eating is meant to be more of a social endeavor. We can enjoy the company of others. It improves our appetite. It also improves the amount of food that is consumed. Now, this is a favorite of mine, aromatherapy. Now, there are real solid scientific studies that say that certain smells are really efficient in promoting appetite. So things like peppermint, spearmint, bergamot, and interestingly, citrus, things like tangerine, orange, lemon, lime, all of these things can really help. So you can either have a diffuser that can be in the dining room, or you can put a little bit of the essential oil on a piece of cotton or dab their shirt with that. It can make a dramatic difference, and it is safe with no side effects. Physical activity. I think it was Covert Bailey who said, if exercise could be made into a pill, it would be the most prescribed medicine in the world. And it is no different for people with dementia. So physical activity can help people with dementia sleep better. It helps with depression, it helps with anxiety, and it also helps with appetite. So give it a try. And last but not least, medications. Now, there are some things that we can use as appetite stimulants. The one that I use the most is an antidepressant called mirtazapine, and the other name for it is Remeron. So the typical adult dose of Remeron is 30 milligrams a day. The appetite dose is a little tiny bit, 7.5 milligrams a day, typically taken at bedtime, and it is in general very well tolerated at that little tiny dose. It has very few side effects, and it can make a world of difference in terms of being a safe and effective appetite stimulant. You can also try dronabinol or Marinol, which is basically cannabis. It is really effective. It can help with nausea, it can help with improving appetite. However, it is the psychoactive fraction of cannabis. So it can, get the person high. And that can be tricky if the person with dementia is unsteady on their feet. To be walking around high may not be as effective. And lastly, there is megestrol or Megace. And this is a powerful medication that is used for cancer patients and HIV patients. And in a pinch, it can be effective and helpful in people with dementia as well. I hope you found this video helpful. And please, if you have some suggestions or you have tried things that have been helpful for appetite stimulation or just food in general in the elderly with dementia, please let me know. Put it in the comments below, and we'll see you in the next video.